Janvi, I think we can start the webinar.
Okay. Good afternoon, everyone. I'm Janvi Pujari, and I warmly welcome you all on the behalf of Fidutsav Dentino's team to this much awaited webinar on medico legal aspects in your clinical practice. In today's rapidly evolving healthcare landscape, understanding the legalities and responsibilities of clinical practice is more important than ever. And to shed light on this important topic, we are honored to have with us a highly accomplished speaker, Dr. Anish Joshi, a critical care specialist and the head of the emergency department at Narayana Multi Speciality Hospital, Rakhial, Ahmedabad. He is also a founder of Jeevant Insurance and has been a strong advocate for medical legal awareness among healthcare professionals. Dr. Joshi brings with him not just clinical expertise but a wealth of practical insights on navigating the medico legal aspects of our professions. Let's put our hands together virtually to give him a warm welcome. Over to you, Dr. Joshi.
Yeah, thank you, Janvi. Uh, this topic basically we present in our hospitals also, and Dhruvil, one of your colleague, had met me, and I have modified it for your dental profession. So I have taken some examples of the dentistry here while I'll be discussing out this topic. The reason is why this is a important topic is that though we consider this as the noblest profession, but over a time the relationship between the doctor and the patient has changed significantly. The inflation, if you see in the medical sector, it has grown by 14%, and majority of the patients don't have any sort of insurance. It's only one third of the patients that are covered under some sort of medical insurance. I'll not be talking about the government sponsored cards because that is given only to a particular sector of the population. And if we see about dental insurance, then it is not actually a standalone policy which is available in Indian scenario. Some insurance companies do provide it, but with either additional rider, or it is a very small amount which is a part of that standard medical policy. Over a time, what we have observed that because the cost has increased significantly, like in your case, it would be the implants and the various dental procedures. The relatives have significant expectations from us, and if that expectations are not fulfilled, then because of their frustrations and tantrums, they are ultimately harming us. And if you see the medical cases that have gone into the law or the court, and the amount of compensation that has been given, then it has been now significantly higher than what it was being given in the past. I have taken two cases which have been there, which were very popular or which were very well discussed in the media. One was of the PU hospital death after a patient was given a local anesthesia, and this was another one famous where the patient was around 27 years male and who ultimately died because of query given high dose of the local anesthesia, which was ultimately not proved. But if you see in both the cases, the police had registered an FIR under section 304 of the Indian Penal Code. Now it's a BNS Act, what we call as, for culpable homicide, not accounting amounting to murder, and they were still investigating. This is of that particular case. So the thing that I want to try to tell you is that it takes away your significant reputation. It puts a significant stress on your mental as well as physical side when there is a FIR done. When the courts have clearly told that unless until you cannot prove that this was a gross negligence, do not try to put codes or do an FIR and arrest the doctors. So if you see, the reason is that we are now living in a world where you will be finding various social media platforms, the Google Baba, the malified intentions of the audio visual platforms, and the lack of unity, which ultimately results in the cases against the doctors. And if you see the cases, they have significantly increased over a period of time. Initially, if the patient used to worsen, then majority time the relatives would never sue a doctor. There would be a little bit verbal discussions and love, and then the patients or the relatives would settle down. But that's not the case now. You generally get a legal notice within say 2 3 months from the lawyer asking for a X or Y amount. So it is a need for all of us to understand and have a safe and practical environment in which we can work without any fear. Some of the reasons for happening of all this is, one is the corporatization of the healthcare. I, being in a corporate world, I know that now the hospitals or the chains which are being managed, they have a profit motive rather than just a service motive. The other thing is that when the case goes into the court, the judge is not a doctor, so he will be relying on what proofs or what recommendations or the references are being given. What is written by you on paper, on your case sheet, or on your prescription would be considered as the thing that you have done or not. And law, like medicine, is not 1 plus 1 is equal to 2. So we need to be very careful and precise in writing the notes, particularly when we are doing any particular procedure, or in your case it would be like an extraction or something. The negligence, when it comes to, it is divided into mild, moderate, and severe, what we call as lata culpa, levis culpa, and levissima culpa. For an example, for your case, I would be, if you removed a tooth, and by chance, because of that tooth extraction, there is another tooth which has some issues, then that will not be considered as a gross negligence, it would be a slight negligence. But when you operate on a wrong side, then that would be considered under the gross category, that the infected side or the side which had to be operated, and you operate on the opposite side because of your wrong judgment or the wrong decision. The another important thing that we will be discussing would be what is negligence versus an error. Negligence means when you don't meet an expected standard of care and it causes harm to the patient, means like a wrong site of operation or wrong medications, or you don't call for the poor or the no follow-up. Here there is a breach of duty and it causes harm to the patient, while error is an unintended act or omission that doesn't achieve the desired goal. So negligence and error, though looks to be similar, you need to be very careful what the problem has happened would come under either negligence or an error. And an error is generally written in our medical books that these complications are known to happen. So you will be having some sort of references in your textbooks or journals which can back you up when you are stuck up at some point of time. So errors are not gross. And if there is an error happening, then also you will have some medical literature that will be helping you if you are ultimately sued. And it can be human or technical, but it does not amount to breach of duty. Means you have done your best to at that particular point of time, but the results were not in your favor, and ultimately the patient worsened. The compensatory mechanisms that are at present would be, one, giving monetary compensation, for which the patient generally approach various types of court, like the civil court or the high court or the consumer dispute resolution forums. Punitive, like the criminal court, in which the ultimately the doctor is sent to the jail under the BNS or the Bharat Nice and the Act. Disciplinary means the patients approach the various councils and request there to remove the name of the doctor, and the doctor is not allowed to practice for either a particular time or for a lifetime. And a recommendatory, where the patients approach the Human Rights Commission and there they ask for the compensation. It is not necessary that the patient would go only on a one particular thing from all these four. They may approach multiple places, like they may go to the court and they may go to the council. And in our practice, we have seen that now the patients are smart enough, they go to the council, approach there and tell that this doctor should not be allowed to practice for a lifetime and his number or his registration number should be cancelled. If we see for the Consumer Protection Act,
your slides are not working. They're not changing. Now they're changing.
Now are you able to see?
Yes, sir. Now. Yes.
Yeah, Consumer Protection Act. Can you see that?
Yes, sir.
Yeah. Okay. If we see in a Consumer Protection Act, the dental professions or the medical profession, are they safe from this act? Then the answer is no. And this was being fought by Indian Medical Association in 1995. This case belongs to that year, and it recently had a judgment finally after around 20 years whether the doctors would be a part of this act or not. and finally the Supreme Court gave the judgment that the doctors would be part of this Consumer Protection Act, means they can be sued by the patients on the part of negligence. And what the court came to a conclusion was about the services, that if the doctor is charging money and giving a service or giving his or her advice, then that would be a part of service and that would come under the CPA Act. Only and only if you are providing free of charge, means the service does not have any sort of financial dealing in that or a sort of personal service, then only it will not come under Consumer Protection Act. If we see the accountability, as a doctors we practice, but generally where will we be practicing? Either we would be having our own hospital or a dental chain, or where means the surroundings or the environment in which we are working. So they are also responsible, and that is what we call as direct liability versus a vicarious liability. Direct liability means the dental chain or the hospital, they have to provide you a safe and suitable environment for working. So if in your case, like the dental chair is not working, or the suitable instruments or the OT in case of maxillofacial surgery are not adequate, and the patient dies, then it would be the responsibility of the that particular dental chain or the hospital also. And vicarious liability stands for when the employer is responsible for the negligent act of the employee during the course of employment. In our case, it is like the nursing staff is ordered something and the nurse gives something else, then ultimately it is my responsibility because it was my order to give a particular drug or injection, and the nurse has made a mistake, and because of that the patient dies. Then that is what is called as a vicarious liability. The common errors that we find in majority of the doctors as a whole is this. Some of them I have written here. One would be an avoidance, that when you are finding that the patient has worsened or has developed some complications, we do not discuss it in detail upfront, that now the patient has developed so and so issue or a complication, and that ultimately multiplies, and ultimately the patient worsens more and the relatives become much more furious. Defensive medicine, it is sending too many tests. In medical side we do have that problems, in dental it may not be so much. Failure to communicate. Whenever you are discussing about any particular case or a surgery, it's best to communicate to the near and dear ones and have their signature on paper that this has been communicated to you. I, being a critical care specialist, in our ICUs, we have significant deaths happening because of the sick patients, and we have always kept an audio-visual counseling room in which we write the counseling that has been done on a muster, plus we record it with a CCTV camera with a good audio recording, so that in future if there is any issue, then that counseling plays a role. Failure to diagnose, that is the essential test which must be done. Like if you are operating a patient, then at least the basic blood reports, the sugar reports, the HIV, HPV that we routinely do has to be done, the coagulation parameters. Failure to identify complication, that the patients develop some problems, then it is best to either get a scan done or call for a help or call for a senior or call for a colleague, rather than managing that complication by your own and creating more problems. Failure of adequate follow-up, that is when you are finding that these patients will require coming back to you after say few days, then that has to be written on paper that the patient is required for follow-up after 5 days. If the patient doesn't turn up and develops complication, then you are safe that I had called on a so particular date, but the patient did not turn up. Giving adequate patient time, that's the must, though it's been difficult in government setups. I'll discuss about the government setups, but in a private, you need to give an adequate time and explain the advantage and disadvantage of a particular procedure or the complications or the side effects of a particular treatment. And prescribing errors. And this world, if we are writing with a pen and a paper and the handwriting are not visible, and because of that the patient takes some another medication, then it is really a negligence. And today there are softwares by which you can actually now type and have a good prescription. The other advantage of such software is that you retain a copy with you. So even if the patient goes into court, you can show that I had mentioned certain things on the my prescription, and the patient cannot change your prescription, because we have found out that sometimes the patient, if the prescription is in 2 pages, the patient would show only 1 page in the court of law, while the second page, which has important other suggestions given by a doctor, are missing. So whenever if you are practicing in your routine life, particularly when you are in private practice, always protect yourself with a indemnity insurance. And it basically is two type of insurance. What we call as, one is the profession indemnity, which is a personal insurance for a particular doctor. Even if you are practicing, say, as a two or three doctors simultaneously, then all the three should have a professional indemnity. It is not on a particular group's name or it's on a hospital's name. An error or an omission policy, what we called, that is to be taken by the clinic or the nursing home along with the staff members, whether they are qualified or unqualified. Both can be covered in these errors and omission policies. The burden of the proof that the doctor has done a negligence lies with the patient. We don't have to show that we are negligent or not, that the patient or the client has to prove to us. And what the law or the court ultimately considers is that the higher standard of evidence than otherwise to support allegation of negligence. Means if the patient goes to court and says that this thing had happened, then court would always refer to the medical literature. And if the literature shows that this sort of problems are common, or if they are even mentioned, then generally the negligence is not proved. So be ready with the scientific literature if you are sued, and take the help of a lawyer. How to prevent this medical legal litigation? If you suppose unfortunately you get a notice from the patient, then the best way is having a professional indemnity and taking a help of a professional lawyer who can draft an answer. Do not write an answer just by yourself, because when it comes to a legality, then you should be having an answer which is written in a legal way along with the medical terms or the medical. So a lawyer who knows some medical terms should always be consulted. When you want to avoid litigations in your routine practice, these are some of the tips that try your best. Always, when the arguments are on in a particular clinic, it is better to say sorry and avoid future problems with that particular patient. Blaming others, this is what we commonly see, that the patient has taken some treatment from another X or Y doctor and then comes to you and you start blaming that that doctor did not do well, and because that you have such complications. Avoid speaking such sentences, because the same thing would happen to you, that the patient may go from you and take a fourth opinion, and there he will speak about you. They always be updated with the latest or the clinical guidelines about that particular surgery or the case. Proper documentation is a must. Recently, I was called in a court for a case which was, say, 8 years ago, and the opposite side lawyer had asked me a question that, by this note, do you tell that you had done everything well? So ultimately, whether you have done well or not, it ultimately counts on what you've written on paper. And no one remembers, say, 7, 8 years old case exactly what I had done at that particular time. But my notes was mentioning everything, and I read that notes and told that no, yeah, I had done the things as per the protocol, as per the guidelines, and ultimately I could not save the patient. That was a different story. But that is how you can defend yourself in a court of law. Always show empathy. The more you are empathetic, the lesser are the chances that you'll be sued. And always try to fulfill the expectations. I'm not saying that always you can fulfill the tantrums and expectations of each and every relative or each and every patient, but be mild in practice, and that generally prevents more, means then you'll have less litigations. Keep the typical policies ready with you, that up to a certain level we'll be managing at this particular setup. If we find that the patient worsens, or the patient has complications, or the patient is high risk, we'll be shifting this patient to a particular hospital or another setup where we have more facilities available. Be updated by various conferences, by guidelines, by this medical literature. Look for the potential litigant. You generally find out a patient or relative that this patient is little bit a nuisance type. That is how we also figure out that this can create problems later on, and we are much more careful in writing our notes, particularly in a case where we find that this patient is like creating more and more issues, or creating problems on a daily basis when we are managing the patient or counseling the patient's relatives. Always take a consent, which is a must. and look for the risk management and the contributory negligence. If we talk about government setups and the government doctors, then since the treatment in government setup is free, they generally are not sued. Even if the treatment is taken under various schemes like CGHS or the various government schemes, then they government doctors are generally not sued in such cases, even if the negligence happens, because this comes under the free category of service. So here I am practically ending my presentation, and we'll take two cases and then we can open it to the question answers. This was a case of a 22 years young female with a history of road traffic accident while she was going on a two-wheeler and collided with a four-wheeler with a transient loss of consciousness with some maxillofacial fracture with no other injuries all over the body. CT brain was done, which was apparently normal. Her basic labs and the X-rays were done, chest X-ray, which were normal. She was conscious, obeying full verbal commands, were fully conscious. So she was posted for a maxillofacial surgery under GA by the maxillofacial surgeon. And just once she was induced anesthesia, she developed a cardiac arrest before the surgery could even start. And the patient, the anesthetist who was there, they gave CPR for around 10-15 minutes, and the patient was brought out to the ICU. Relatives created ruckus at that point of time that they were not made aware of that this could happen. And the patient was on the ventilator. Then the neurophysician was called, EEG, MRI was done, and we showed a hypoxic ischemic encephalopathy. And this is a real scenario, a real case. It's not a hypothetical case. This we have already seen in my practice. The patient after 15 days was off the ventilator but having a tracheostomy in situ. The patient was having hypoxic brain damage, so she was not conscious or obeying commands. She was like in a vegetative state, and the relatives have now filed a complaint against the hospital as the treating team of doctors. It was a surgeon plus the anesthetist and the hospital management that there was a negligence, and ultimately because of it our patient had such sort of thing. So I'd like all of you to just give how would you safeguard yourself or the hospital in this situation, then we'll discuss further. Anyone would you like to answer this?
By recording every procedure?
Yeah, so see, if you see this case, the patient was otherwise fairly okay, young patient, no other comorbidities. But if you see the history, there was a transient loss of consciousness that was mentioned. So in such scenario, always first try to call a specialist of that particular. When you have a loss of consciousness, it's better to call for a neurophysician upfront rather than going ahead and doing a surgery immediately. So that was one of the factors. Second thing, that they had done only CT scan, MRI brain was not done. So that was something which was actually to be done when you have a trauma protocol. And if the neurophysician or neurosurgeon would have been called, then this would not have happened, or at least even if it had happened, then you could safely say that I had called and so specialist. Whenever there is a road traffic accident or an MLC police case, it's better to involve your colleagues of that particular specialty. Don't worry about 4 more references or about the money, because these cases, when they come in court, they come late. You may not remember what actually had happened at that point of time. You have to be very particular in all your documentation. What Arvind was saying, that a proper recording of the things, if the relatives would have been counseled well by the surgeon as well as the anesthetist, majority case what we have seen, anesthetist would directly come into the OT. He or she would never ever meet the relatives or the patient outside the OT and introduce him or herself that I am the anesthetist, I'll be giving the anesthesia to your patient and so and so. And some complications of anesthesia has to be mentioned whenever you are knowing that you are giving anesthesia, though the risk may be very small, but you need to tell that these are some of the side effects or the problems. Like आज આપણે tooth extraction કરીએ તો we know nothing is going to happen, and majority thousands of tooth have been removed, nothing goes wrong. But when in one tooth something goes wrong, and your life is screwed, right? So taking an adequate precautions in each and every procedure is a must and should be done. Then only this litigation, because this case is now in the court, Though it has not come to a final verdict state, the statements and what we call as cross examination is going on, right? The police can ask for the CCTV footages, right? As per law, you cannot have a camera at certain places. If you would have read in the newspaper about that Rajkot gynec hospital clips being circulated, so that also plays a role. But wherever you can have the CCTV cameras, like in your consulting room, better to have that with a audio recording so that you can show that this was common, means you told this to the relatives or the patient. Second most important thing what we always face is that if the patient is conscious, take his or her consent also. Majority times so like we take the consent of the wife or the son or the daughter in a case, and then the things go on, and later on the husband or the person who was actually whose surgery has been done, I was not informed that this and these things have to be done. Second thing we face is that you take a consent for a particular surgery or a particular thing, and when you start operating, you find that something else also has to be done, right? And in the better interest of the patient, you always operate that thing and come out and then tell the relatives that X thing was to be done, but we found that X plus Y thing has to be done, so we have done both. But when you are doing other than what you have consented in the paper or you have explained to the relatives, it is better to come out from the surgery, tell the relatives that though this only thing was to be done, but since we are finding in this plus this thing, the other thing we'll be doing, we are explaining you in the midway. If you give consent and a second consent has to be signed, or you have to mention in that consent with the date and time at so and so particular date and time, I have told the relatives that this has to be done simultaneously, so we are doing, right? And this is very common, particularly in gynec practice, that khali uterus kadwanu kidhu and they come out with uterus and the ovaries, and the relatives ultimately you removed both when only uterus you had explained to the us. So this is very common, and we need to be much more careful. Second case, there is a 65 years female who was diabetic, hypertensive, had a cardiac history, and she was traveling to a native in the periphery when she started having fever with chills and the pain in the right side of the mouth. So આપણે જેમ routine હોય છે કે they would call her family dentist on a phone and ask her કે what ma'am or sir I could do. The dentist managed her through a tele-digital mode and WhatsApp per ke her gave advice of, and with a suspicion that there would be some pus formation, and she started antibiotics and the supportive medications with the advice to take plenty of fluids orally. The dentist also had advice of some basic labs and the X-ray of that particular side, but the patient did not do it because where the patient was, they did not have facilities. He was traveling. Meanwhile, the patient developed altered sensorium with drowsiness, so she was shifted to a nearby center, but on the way became hypoxic and hypotensive, went into septic shock with multi-organ failure, and by the time she was shifted to some bigger center, she collapsed or died. The patient there was managed with all aggressive form of management like ventilator, dialysis, antibiotics, the routine care. But the relatives had blamed the doctor who had first managed on the phone, on the tele platform, that he or she has not given proper guidance, and that's why our patient deteriorated. So just this is the common thing that phone આવે કે સર આ દુખે છે મને કંઈક લખી આપો ને, it's our common કે we type and send augmentin 625 milligram BD. That is the routine thing that we do, but we don't know the consequences of this. So better avoid writing such sort of medications, particularly on a WhatsApp platform. Though now the tele platforms are considered to be legal, I am a part of Telemedicine Society of India, but it has to be through a official or a proper software rather than just writing on a WhatsApp is not considered to be an official platform because it's considered to be a social media or a messenger platform. So be very precise. Mention, like in this case, a doctor had also asked the patients to get some blood reports and the x-rays, which the patient did not do. So that was in favor of the doctor, that he or she had advised the patient, but the patient did not do. So if you see these two questions, the telemedicine platform, whether it is legally safe, the answer after COVID is now yes. You can manage the patients on the telemedicine platform, but always when you are mentioning, I mean, giving a prescription via tele route when you're not seeing the patient in person, always mention at the line, one line, okay, this is a telemedicine prescription or a consultation, and I have not seen the patient in person. And how can you safeguard yourselves in this world where now teleconsultation or telemedicine concepts are very much in demand? Then always tell the patient that the prescription that I am giving, and if you are not settling down, say maybe within 24 or 48 hours, better go and take a physical consultation as early as possible. And this has to be mentioned in your prescription that you are sending to the patient. Keep a copy of this. WhatsApp chat delete થઈ શકે છે, but our softwares in which we write prescriptions are generally never getting deleted, or you should take a backup of that software. It's better to spend 5-6 thousand per year behind a good software and having mental peace of mind rather than finding the prescription when there is actually an event. And if you see for medico legal cases, the time span up to which you need to maintain the prescription is practically lifetime. For other cases, you can destroy the papers after 7 years if something means everything is fine and there is no lawsuit against you. You can discard the papers of the patients. But for MLC, means for a police case, you need to keep it for long. So this is what was about the medical legal aspects. The take-home points would be proper documentation in law. Only and only the what you have written on paper counts. If you have mentioned nothing or your notes are not there, the law will not leave you. They'll say because you have not written anything, you have not attended the patient. That comes to the court of law. Focus on giving reasonable care to the patient. Establish proper protocolized environment at the clinic, and all policies have to be well in place. Along with documentation, communication, and counseling are a must in establishing doctor-patient trust. Spend adequate time in counseling the patient's relatives on a daily basis with proper what SNDT, what we call as, that is sign, name, date, and time. Means these four things are a must, that whenever you are writing anything, mention the date with the particular time. Your name and your signature are a must in any sort of the prescription or the notes that you are writing. And transparent counseling is a must, and have a good profession indemnity insurance to safeguard against any unpredictabilities if any happens in future. Thank you. If you have any questions, do let me know.
If anyone has any question, you can type it in the chat box. Any questions? So Tanya is saying, what are the softwares acceptable legally for telemedics?
If you see now, this government, they have come up with this ABHA ID. So whenever you are practicing, always go for a software which is ABHA compliant. And when we say ABHA compliant, then automatically it means the software becomes compliant in all legal angles, because these softwares have a significant what we call as encryption which is required, and so that there is no data theft happening, and the sharing of the information would only be in the proper way. So if you see, I am not promoting any particular company, but like we are using Helplix. So that is a Bangalore-based software company. There is a Bajaj. There is significant, means many EMRs are coming. Look from two ways any software that you are going to purchase. One is the cost, because ultimately that also plays a significant role. The average cost of these softwares per year, they are always on a per year subscription basis. So they would be somewhere around 5 to 10,000 rupees per year. And second, interchangeability. Suppose I am not happy with a one particular brand or a software, and I want to shift my data, say my all patient data from an X software to Y software. Is the new software allowing me to do that? Or can I download my patient detail in either a PDF or Excel? If that is possible, go for that particular software. So that is how we are going to select a particular software. For dentist, Bajaj is a good software. My wife is a dentist, so I know she's using that since long.
Any more questions?
I think Janvi questions are over.
Okay. Thank you so much, Dr. Joshi, for this eye opening session. The medico legal knowledge you have shared with us today is not just relevant but essential for each one of us stepping into clinical practice. To everyone who joined us, thank you for being such an engaging audience. We hope that this webinar has sparked important thoughts and helped you to feel more confident about this legal side of healthcare. Thank you so much, everyone.
Okay.
Thank you, sir.
Yeah. Bye.
Thank you, sir.
Bye.